Noswaith dda a croesawu pawb I briefio bydd iechyd y ddysgu Powys Haino. Welcome everyone to tonight's Powys Teaching Health Board briefing. Now before we begin, I'd like to provide a brief technical introduction. As normal, we're using Microsoft Teams today, and this means that not only can you watch the meeting, but you can also take part. Now on your screen, you should see a tab with a question mark on it, and this will normally be in the top right of your screen. If you click on this, it gives you the opportunity to post questions. Please accept our apologies that we may not be able to answer all of the questions during today's meeting, but we will continue to update our website with the latest information about all of our plans and priorities. Microsoft Teams also offers you the opportunity to see live subtitles of today's proceedings, and you should see a button in your settings to switch on subtitles. We have those available for today's meeting in Cymraeg and English, as well as Arabic, Polish, Bulgarian, Slovak and Urdu. Today's meeting is also being recorded. Now don't worry, it doesn't share any information about you in the audience, just the information that you see broadcast on the screen today will be visible. This means that people who are not able to join us live right now will still be able to watch today's briefing at their leisure at a future date. So thank you so much for joining, and our briefing will now begin.
Prynawn da pawb, good afternoon everyone. My name's Carol Shillabeer and I'm the Chief Executive of Powys Teaching Health Board, and hello to the people who are regulars tuning in to our latest updates and our question and answer session. I do hope that you're keeping well, and I look forward to seeing some of the questions a little bit later on in the brief. So since we last caught up together, an awful lot's happened, and we're trying to give you a whistle-stop tour of what we've been up to, the current position in relation to COVID-19 incidents, our work collectively on Test, Trace, Protect, and importantly, the more major changes on the vaccine programme. I'll also take the opportunity, if that's all right for us, to think a little bit more about winter and being prepared. So just to start with, we remain at level 0 on the alert level, and we know that the government continue to review this every 3 weeks. But I would wish to stress that we can all continue to take the advice around hands, space and fresh air. It's useful advice, even if we don't have those formal restrictions in place in the same way as we did previously. So we have now had the Welsh Government's latest coronavirus control plan, and it talks about environments of being COVID stable and COVID urgent. And we all hope, I know, that we don't get to a place of needing to go into COVID urgent. So those precautions that we can take in our everyday life will help to keep us at a stable position. And that's because really the third wave has really been upon us during the summer period, and we have had a significantly high circulation of coronavirus in our county. And if I just give you a sense that these rates have been about 85% plus higher than the highest point in the second wave. So previously, and you can see the chart on the right there where it talks about new cases in the last 7 days, 611, and cases per 100,000 in the last 7 days, 461. If I spin us back for a moment to Christmas, or even a little bit before October, November of last year, we just breached the cases per 100,000 of 50. And that, of course, was triggering local lockdowns, and then, of course, the more national lockdown during the winter period. So what's very clearly different about the situation now with the third wave is the impact the vaccination programme has had on the number of people becoming seriously ill and needing to be admitted to hospital. Again, of course, one of the objectives of the government and the public health system was to ensure that their NHS did not get overwhelmed. And so the ability to manage a case rate of 461 per 100,000 in a COVID vaccination environment would be very different to when we didn't have COVID, the vaccine, I mean. So just want to remind people about the testing that's in place, but because of course, you know, with such high case rates, our testing facilities have needed to really make sure they could expand and cope with the demand that is coming through. So PCR tests are available for people with COVID symptoms, either by post or from testing centres across the county, and we continue to have a range of those. PCR tests are also available for people with a wider set of symptoms beyond the classic COVID-19 symptoms. And the reason I mention that is there is some thinking, and if you follow the Zoe app, as I do, there's certainly an argument put forward from the scientists there that if you've had a vaccine, there are potentially wider symptoms that are more emergent. So to keep that broader sort of frame of mind really about symptoms that you may be experiencing. And then the LFD lateral flow device tests, they're available for people without symptoms. And again, by post, you can get those, or from collection points across Powys. So really important still to get tested. And we do keep a track on who's being tested at the moment. Children are being tested a lot of children being tested, and quite high case rates in amongst children. Now, interestingly, of course, children are largely the population that have not been vaccinated. So the virus will work to find those who are unvaccinated, and we are seeing that certainly in Powys. If we move to the next slide, just the sense here of giving you a bit of an update on our first and second dose programme. So this was for people over the age of 18. And we every time we've caught up, we've been able to give you a bit of an update on this. So the headline level, 91% of people have had their first dose and 88.6% of people have had their second dose. That's a phenomenal, absolutely phenomenal rate. And thank you again to everyone who has come forward for a vaccine. We're so delighted that the people of Powys have really embraced this and supported our collective work and efforts on this. It does mean that we have maintained really good progress and are leading amongst Wales, and Wales is still doing extremely well indeed on the UK stage. But clearly there is more to do, and I'm going to come on to a little bit more of that shortly. So for those of you who've tuned in regularly, you'll remember the bar graph at the bottom on the left here. And really, we want the grey to disappear, both with green, which is the first dose, and then with blue, which is the second dose. And we're going to have to be updating our colour scheme here, of course, because I'm going to tell you a little bit about the other mechanisms of boosters shortly. But that's the picture from the first and second doses. So if I move to the next slide, what this tells you is that actually phase 3 has now started. We're well underway. This is the autumn and winter programme. Couple of important things to remind people of. So when I talked about 88.6% of people having come forward for their second dose and 90% for their first, it does mean that we've got 11% of people who've yet to come for their second and 10% who've yet to come for their first. So we are always open. And I would encourage people who have not been vaccinated to really think seriously about this vaccination. I know that there is dis and misinformation around, and so if you haven't had the vaccine and you'd like to talk to someone about it, we're here to help. Of course, it's informed consent, but what I would want to stress is that the accurate information is put in front of you, and any questions that you have, that we're able to answer those in an open and transparent way to help your decision making. So we're always open. Now, the vaccination for under 18s, I think there was quite a lot of interest in this. So we had the 16 and 17-year-olds. So they were the first cohort that the JCVI, the Joint Committee on Vaccinations and Immunisations, said, yep, they should have the vaccine. So we started those back we were doing those in August, September, and I'll tell you a little bit about the uptake on that. So that's excellent. And then, of course, the 12 to 15 year olds. Now, it was a more complex decision in relation to this, because the JCVI said, well, on an individual basis, children who have COVID and who are healthy, no underlying conditions, actually they can be unwell, but they don't often suffer severe illness. So on an individual level, they didn't feel that there was enough to sway them to say you must do a universal programme. But the chief medical officers were asked to have a look on the wider impacts of children having COVID and the impact that has, particularly on their education. And so it is on that ground that, taking all the evidence into account, that the chief medical officers from the 4 UK nations recommended that children aged 12 to 15 be offered a single dose, that healthy children. So I think that has been quite an interesting development for us, because we've had to try to adapt our system of working to ensure that we can welcome 12 to 15-year-olds and support them with their decision making about vaccine. And then booster programme, in line again with the national guidance, and we've started this and we're going great guns so far. So again, people who were in the higher categories, or people who had their vaccinations first often, so people who live in residential care homes for older adults, adults aged 50 and over, frontline health and care workers, those people who are under 50 with an underlying health condition, adult carers, and adult household contacts of immunosuppressed individuals. So they are all in this cohort. I just want to pull out one element, and it's in the box just on the right-hand side there. For people who are severely immunocompromised, immunosuppressed, so they're people for whom their condition or their treatment for their condition really pushes down their immune levels, they're being offered a 3rd primary dose. So that's not like a booster dose, that's a 3rd dose. So most people now have had 2 doses. This group will be offered a 3rd dose, and that's separate to the booster. So that is also underway. So I think you'll be able to get a sense that after we've done the run up on phase 2 and ensuring that 1st and 2nd doses were all done, we've now got quite a complex programme to be delivering. But I'm going to just tell you a little bit about how that's going on the next slide. Can I just say a massive well done to 16 and 17-year-olds here in Powys, because they're the group that have come forward in such numbers that mean they're on that table there on the right-hand side, and this was a few days back now, that more children, percentage-wise, more children aged 16 and 17 in Powys have come forward for their vaccine than anywhere else in Wales. So And you could argue, of course, with our rurality, it's perhaps even more challenging. So, fantastic achievement. And, I think we look to our young people to, be taking decisions for themselves and thinking through the choices that they're making. And they're clearly taking the vaccination. We've already offered 12 to 15-year-olds with an underlying condition vaccine. So some of those children have come through already, which is excellent. And we are now holding clinics as well for all 12 to 15-year-olds, and that started a week or so ago. And we'll be running those through. Largely, we're really, really keen to get as many children vaccinated during October as possible. There is half term, of course, coming up, and what better time to get a vaccine than at half term? So we've got a lot of work scheduled at that time, and we'll see what the response is there. And we have young people who are mostly able to make their own decisions about vaccination. So we've got extra mechanisms to ensure that people are supported, information is given, and young people are able to make those decisions for themselves. We have taken an approach of using the mass vaccination centres largely for the 12 to 15-year-olds, and that's for two reasons really. One is, schools got a lot on at the moment. They are dealing at the moment with lots of COVID concerns, and we know that there's a couple of schools in particular who have been sort of harder hit by that increased case rate, particularly amongst young people and teenagers specifically. So they've got a lot on with that, and they've also got a lot on with education. They've got lots to catch up on. And so on balance, in discussion with colleagues from education, we felt offering the vaccine in the mass vaccine centres was probably the most effective way of doing that. So we're very keen that people are able to get it across to us. Now, when the end of October comes, that doesn't mean that if you're 12 to 15, you've lost your chance. There will be some drop-in clinics available from November onwards for this group as well. So if I can move next then to what does this actually mean in totality? And our next slide helps to explain the number of booster doses that we've got under our belt already. Again, we only started this very, very recently because the JCVI published their guidance on the 14th of September. And we've got to take the guidance, put that into protocols, make sure staff are updated with their training, because with each new piece of JCVI guidance, we have to make sure that all of our policies and procedures are up to date. But we did that very, very quickly, which meant we could start boosting people's vaccination on the 18th. So excellent turnaround time. We did some sessions first and foremost, trying to focus on frontline health and care staff because we didn't know when the booster guidance was going to be published. It takes a couple of weeks to get appointment letters or sent out and giving people enough notice. So we started off with health and care workers. They were able to drop in and all sorts of things. So that's worked very well. And we've now got appointment clinics underway. I was at the centre in Brontlease earlier on Monday and saw an array of people, but some were health workers, some social care workers, some members of the public, particularly those in the older age group who had their vaccine first. So just as a way of reminder, JCVI is saying you should have your booster no earlier than 6 months after your second dose, but really 6 to 8 months is a great window of which to have that. And for us, of course, because the guidance was only published in September, there were some people who were a bit outside that and really 8 months plus. So we're getting those in as quickly as we can. So this time we have we've stuck to the model of mass vaccination centres, but we've expanded that a little bit more because previously a large range of our GP practices were supporting the vaccination programme. Now we know that we're all trying to do lots of things at the moment. So we've got high COVID case rates, we've got vaccination programme, but we've got all the backlog work and the usual work. So the arrangements with colleagues in primary care were to get a balance of making sure that we weren't using primary care too much because they've also got a huge amount on, but trying to use them where they felt they were able to support. So we've got arrangements in place for Rhaeadr, Prestine and Welshpool. They're offering vaccination for people who are over 18. And Prestine will be vaccinating in Knighton, and they'll also offer to Knighton patients over 80. So we've been able to do that. We've been delivering boosters in care homes, which is great. Getting that programme up and running, and over 10,500 so far. Have been vaccinated, so that's excellent news. I do want to say just on the next slide about the flexibility of our arrangements. So important really that one of the keys to our success, we've often been asked, so how's Powys got on so well with this, with all the rurality and all of this sort of complexity, and the Pfizer drug, the cool temperatures and all of that. So how have we managed to get ahead? Well, excellent communication. I'm not saying that because the communication team have set up this session for us, but we've been trying our very best to make sure we're connected with people in the communities and offering reserve lists, standby lists, and actually people in communities, people like yourselves, have been really supportive of that and have taken very pragmatic, practical given practical attention to actually, if a slot becomes available, I'll get across and I'll use that slot. And our wastage rates have been really low of the vaccine because people have been so accommodating and so flexible. So here we are again, a reserve list is in place. So you should expect to have your invitation letter somewhere between the 6 and 8 months after your second vaccine dose. If you're in an eligible group, remembering it's over 50s at the moment and those with underlying conditions, but there's a reserve list. So, please do, if you're thinking I could come at short notice, please do put your name on our reserve list. If your second dose was before the 21st of March, of course. So we'll be running a reserve list as well for age 12 to 15, and don't forget first and second dose appointments, drop-in clinics, etc. So I know it gets a bit complex, but please do, there's lots of information on our website. Please do take a look at that, and hopefully that will help you. Just a moment to talk about the COVID pass. A bit controversial, I guess, last week for those who've been keeping close to this. But the reason I wanted to say something about this, now the NHS itself isn't running this COVID pass system. It's a government system, of course, and of course it links into the NHS's data. But we're anticipating, we've seen this in a couple of areas, that Christmas looks like quite an important time, and people might want to get their 2 doses of the vaccine in to be fully vaccinated so they get a COVID pass. So planning ahead is a really good idea, because if that appeals to you or someone that you know, then you need to be getting in pretty quick with your first dose in order to get enough time then to get the second dose in as well. So there's a note there. Please don't contact us about a COVID pass issue if you can help it, because we don't run it, so we don't administer it. But if there is a Powys vaccination that's missing from your COVID pass, then please do let us know. And then the final thing that I wanted to really draw attention to was COVID vaccination and the importance of that for people who are pregnant. You may well have seen quite a lot of coverage of this in the media. We know that 1 in 6 people, I think it is, who have been in intensive care and pregnant have not had vaccine. So 1 in 6 people in intensive care at the higher end of severe illness have been pregnant. A lot of people were concerned about having the COVID vaccine during pregnancy, but so the evidence is now bearing out significantly higher risk of hospital admission and more severe illness compared to the non-pregnant population if you don't have the vaccine. I would strongly recommend, if that's you or someone that you know, that they have a conversation with Powys midwife or their obstetrician and just talk it through. And we want to make sure that you're as informed as possible on that, and you can then make your own choices. So that's it on COVID. So we've covered the high rates, we've covered the alert level, we've covered the testing. We've just covered now what is quite a substantial COVID vaccine programme. We are expecting to have more advice from the Joint Committee of Vaccination and Immunisation. We don't know when, but we know that they are considering things like, should 16 and 17-year-olds have a second dose, for example, because they've only had 1 dose at this stage. Where should they go then with 12 to 15-year-olds? And should people who are under 50 without underlying conditions also be offered a booster? So they're talking about these sorts of things, and so we're keeping alert to any further guidance and advice that comes our way. I wanted to talk finally, before we go to question and answers, about winter. Or actually a bit about summer, and the next slide helps us with this. So summer has been like no other summer for the NHS. If I can just say, the NHS in the summer is usually a time where we have staff on leave, and we're able to catch up on work and often planned care, because the emergency system calms down a little bit during the summer months, so we can get lots of planned surgery and outpatient appointments done. This summer has been very, very different, and it has felt like winter in summer, not of course because of the weather, because it was glorious for much of the summer period, but because it felt like winter pressures in the NHS and in social care actually, and it's a joined up system, and we see that more and more when we get under pressure, how important that hand in glove work is. So what's happened during the summer is very high case rates, and so lots and lots of people with COVID not getting as sick as previously, or certainly not in the numbers. So we didn't see the level of hospital admissions we've previously seen, thank goodness, which has been really, really helpful. But what we did see is lots of people off work, and people self-isolating. So you'll recall the phrase pingdemic. People getting pinged a lot because there was a lot of the virus around. So people then having to isolate, which meant a significant challenge on staffing services, staffing shops, pubs, restaurants, all of those sorts of things. But certainly in the health service, that's been a major problem. We also then saw the knock-on effects to that, where if you haven't got staff to deliver, for example, home care, domiciliary care, then very hard to discharge people from hospital without having the right care system in place. So the hospital has been gridlocked right the way through then to ambulances who are trying to respond to people not being able to drop their people off at the hospital, so people waiting in the back of ambulances, and then of course that's ambulances tied up, which means they can't respond to emergencies so swiftly. We've had all of those problems throughout July and August and into September. We're still in the position where we've got a lot of people who are in the hospital system in Wales who really should be at home or in a care home with the right level of care in the right place. That is not working effectively at the moment. And I know that their colleagues right the way across health and social care services are working very, very hard to support that. Now, much of the pressure is not because of COVID, because as I said, although the case rates have been very high, the admissions to hospital have been much lower. But we've also got an environment in hospitals where we have to continue to take the precautions to reduce the risk of spread of infection. So where we might have had so many beds, we're seeing about 10% fewer beds available in the wider system because of those COVID measures. So you've got to have beds spaced apart, so far, which may mean a bed has to come out of a bay, so that's one less bed, and you replicate that across the system. We've also got, of course, social distancing elements in the ED department, so not as many people can fit in there, and that has a knock-on effect, etc., etc. And of course, with the staff absences that we've experienced, it's been extremely difficult. Enough probably of describing the difficulties. So what is it that we're doing and we need to do more of or less of to prepare for the winter? Because if it's felt like winter in the summer, for us, busyness wise, we've got the autumn and the real winter to come, of which we always expect to have increased seasonal illnesses, common colds, flus, respiratory viruses more generally. And because we were all tucked in last year in social isolation and restrictions, we're mixing much more now. We are anticipating an increase in respiratory viruses circulating and more people being affected by that because our general immunity is a little bit lower. I'm going to come on to how you can help with that very, very shortly. So this is a framework that we're using at the moment, and I'm delighted to say that the Health Board, the local authority and the third sector working very, very closely together. And you can see mention of other partners, including the Fire and Rescue Service, actually, who have been fantastic as always in offering support. But it's very important for us to see the pressures in the system, so we'll become a data-driven system. Where are the difficulties? Let's anticipate them. Where are they likely to be if they come? And how do we get the early warning systems really working well so we can intervene early? So that's what that means. Important for us to have public awareness and engagement campaign so that people can start to prepare for winter. I don't know about you, but we always try to make sure we got good stock of simple painkillers, some throat lozenges, and all of those sorts of things that you might need for winter, so that we've got that. If you take regular medication, for example, that we make sure we get that well in advance, and all of those things. We know where our high street pharmacy is, and we know how to access those sorts of help and support, and the things that we can do to keep well. We've got some prevention work. We've talked about vaccination of COVID, but really, really important for the flu vac this year. Really, really important. Now, there have been a few issues with supplies, but they're being sorted now, coming through. There's supply chain challenges in many areas of our lives, of course, but we've now got the flu vaccine coming through. So we really want to push that quite hard this season. It feels really important. And there was some coverage the other day about having flu and COVID at the same time, really increasing the risk. And we're very mindful of warm homes, and that is a real challenge. I know they worry about fuel costs, but there is a direct link between having a warm home and health. So health and housing's got a real link, particularly with respiratory conditions. So again, working with the local authority about raising awareness about the benefits that are available and the advice about keeping warm. And if I'm going to just run through a couple of these other things. So we know that we have people in our communities who are more on the frail side. So how do we make sure they've got good support plans, and that we can plan ahead if there's a deterioration or if they need a little bit of extra help and support? That's important. working very closely with the emergency ambulance service and with fire and rescue, because how do we all work together to ensure that the response to the sickest people is really swift, and that we can support those people for whom something different might be in the best sort of interest. Making sure that we can access same-day emergency care, and district general hospitals are more and more offering this. So it's not a sit in the ED for hours. It may well be that it's a booked on-the-day appointment at a district general hospital, and hopefully more and more of that will become available to us and be extremely effective. Enhanced discharge to recover and assess. We've got this service that we've introduced and increased over the last year or two, which is really about very active rehabilitation and therapy support in people's own homes. We know people tell us all the time, I'm much better when I'm at home. I just need some help. I need to recover in my own home, in my own bed. And so we've almost taken our services and brought them to people rather than bring people to the services in hospitals. We know that hospitals are not the best place to do recovery. You don't often sleep well, it's not your own environment, you probably don't walk around as much, and this deconditioning can become a real problem. So we flipped that, and people seem to be recovering much more swiftly and much more satisfied with their own progress and the service that they're getting. Hospital assessment and decision making. I think we keep people in hospital for too long at times. And therefore, because we're putting so much support into communities, we want to offer people that opportunity to go home a little bit earlier with support and with the safety net. So we're looking at that. I've got a very elderly grandfather who's very frail, and he says to me, don't let me go to the hospital, keep me at home, whatever it takes, so that I'm at home, because I went in before and it was hard to fight my way out, he said to me. So you know, I think more and more us being able to provide those services in people's own homes is what's needed. But for those who really do need to be in hospital, that effective community hospital is really important. And we've got some staffing issues there across the UK, and we are not immune to that. So we're struggling at times to really staff. We've had a fantastic response to our nurse training scheme that we're running here in Powys. We had 4 places and we had 100 applicants, so we've just doubled the number of places. I'll be working through that. So our Health and Care Academy coming through now and helping us. But of course, that's not a short term, that's a more longer term investment. And then I'm just going to cover off a couple of other things. The voluntary sector home support, absolutely critical. We know that the resilience and the support provided in communities by communities has been the backbone to the COVID response, really. And so we're hoping that we'll get some money from Welsh Government to expand home support in the area. And importantly, social care areas such as domiciliary care and care homes are feeling rather fragile at the moment. The staffing issues, the workforce shortage is the #1 issue for any NHS chief executive in terms of being able to provide services at this stage, I should say. Domiciliary care and care homes are really critical parts of the whole system for service delivery. So we are working very closely with the local authority. And then there's something called the choices framework. That really is, if it gets really, really, really very, very difficult, what do we stop doing? What do we suspend? What do we temporarily pause? Now, we will be looking at that so that we can be planned, so that if it gets to this level, this is what we do. If it gets to that level, that's what we do. So I'm hoping that, or certainly intending, that's an absolute last resort, but it's very important for us to plan. Now, importantly, I want to stress how key our partners have been and will continue to be. So, and I could do a big long list. I'm going to pull out a couple. So our colleagues who work in district general hospitals, they're very important to us. So we've got to do that joint working. Our colleagues who work in local authorities and actually in the independent sector provision as well in social care. Our colleagues who work in the ambulance service and in fire and rescue, increasingly, important partnership there. And then our key stakeholders, so Community Health Council, for example, but also local councils and county councillors. I think this autumn winter is a really collective effort to try and get us through. We know that the coronavirus, we've managed to put a big dent in it with the COVID vaccine programme, and we are slowly making progress, although sometimes it feels 2 steps forward, 1 step back. But to manage through the winter, I think we're going to be working together. Now, I've spoken for far too long, and my apologies for that. And I'm hoping, though, that that's been, a fulsome overview of where we are in this briefing. And I look forward to seeing if there are any questions that members of the public have. Or as always, I look forward to hearing the questions, and I'm handing back to Adrian.
Fantastic. Thank you very much, Carol. That presentation covered a lot of ground.
Oh, Adrian, I can't hear you. Sorry.
Oh, can you hear me now? I'm just trying to put my microphone back on and off. Yes, can you hear me now?
Yes, we can hear you.
Okay, other people, can you hear me, Carol, or others can hear me?
It's me. It's because I haven't got my ears in. Adrian, goodness me.
Fantastic.
I took my little headphones out earlier, and so there we are. That's why I couldn't hear you. Well done. My apologies. Long day.
Excellent. So I was just saying, great presentation that covered a lot of ground, and in fact has covered a lot of the questions that have been coming in. So I might cover some of the more COVID related ones later, as some of the detail was covered in your presentation, and perhaps start with some of those that weren't covered as the issues in your presentation. So we've had a question in asking what's happening with the Newtown Hospital proposals, the Rural Regional Centre. Where are we up to with that?
Oh, great question. So this is really where we're at. So earlier in the year, I can't remember what month, I think it was either very late last year or early this year, we submitted to Welsh Government something called a programme business case. What that means is it's really a statement of intent, and it's very important for us from the health service point of view, because we are, if you like, directly managed by Welsh Government. Very important for us that we get support from Welsh Government to proceed to the next stage. So we submitted, and when I say we, it's the Health Board and the local authority as statutory partners. But working, of course, with other sectors, and in particular the voluntary sector. But we submitted a programme business case to Welsh Government. There was then, of course, the election, which they couldn't, so they didn't have a chance to review it, scrutinise, and make a decision on that before the election. So it's still with Welsh Government. But what I've heard over recent weeks is that they are reviewing the detail of that in a meeting in November. So I'm hopeful that that will mean that we get a very strong green light. Now, I do know that there's a lot of support for the development of more services in North Powys. I know because managed to speak with people. It's some time ago since I've seen people face to face in the flesh, so to speak, but huge amount of support when we did our engagement work, and still, I get emails that say what's happening in North Powys. We're really, really keen. But I also have picked up significant political support in Welsh Government. So the First Minister on the floor of the Senedd particularly mentioned this and saw this as an innovative and forward-thinking development. Now, I don't want to ever put words in his mouth, but he said that on the record. And so I'm hoping that means that he's very supportive and it will get signed off. That is an important stage for us because we're actually working on the second stage already, which is the development of something called the SOC, which is the strategic outline case. It takes it to a bit more detail. So we've been working on that in the background, and we're very keen to start having some local conversations now that we hope that we're coming out of the pandemic to restart those local conversations about the next stage. So we've been diligently trying to work in the background, despite all of the pressures that have been going on, to prepare so that we don't lose any time on moving forward. A couple of things I do want to say, though, about the things that we're doing now. So we've got a series of what we call accelerated change projects. So it's not about, let's wait a few years till we get a building. It's about what we're doing now. And I'll just bring up one service just as an example. So we're going to be expanding ophthalmology services, so eye care services directly in North Powys. And these are services that at the moment people are travelling for. Out of county mostly, and we think we can provide them in county now. We've got all the kit on order. Welsh Government paid for all of that, so that's fantastic, and we're just recruiting the staff into that. So long as we're able to recruit, that will be one of a series of accelerated change projects, and we'll make sure that we can share that information with people as soon as we are able to, and particularly when patients start attending that service and hopefully get the benefits out of that. So it's very, very much a priority, the North Powys Wellbeing Programme for the Health Board, and I know for the local authority as well. So thank you for asking that question. I'm very keen to be able to get out and about. High COVID rates and then the fuel issue seem to want to stop us in our tracks, but we'll get that sorted, and then we're looking forward to some more of the public engagement events.
Fantastic, thank you, Carol. And actually, one of the people working behind the scenes on tonight's meeting is our colleague John, who's the engagement lead for the North Powys Wellbeing Programme. So I know he'll be taking those comments on board, and he's got plans in place to ramp up the engagement and communication over the next few weeks to bring together public views in the development of that strategic outline case. And I think a really important part of this process as well is the continuous engagement and the scrutiny and challenge from the Community Health Council as that really important body to represent the public interest. And very timely having that question, as there's a meeting tomorrow of the Montgomeryshire Local Committee of Powys Community Health Council, where there'll be the opportunity to update them on the progress and the next steps. And I think clearly one of the issues for that programme actually is how we respond to the future fit proposals across the border in Shropshire for Shrewsbury and Telford Hospital NHS Trust. Now that's been a bit quiet for a while, so do we have any sense of what's happening next with the reconfiguration of hospitals across the border in Shropshire?
Thanks very much, Adrian. Probably much the same as our response, my response on the North Powys, really. So whilst the whole pandemic and the pressure's been going on, there has been some quiet work moving forward, trying to make sure the wheels don't sort of grind to a halt on these really important longer term developments. And so managed to catch up with colleagues from Shropshire, Telford and Wrekin both last week and this week on where they're at. Had a great briefing last week. This week was more around the restarting some of our mechanisms for communication, engagement, sign off of developments. So my understanding is that the SOC, the strategic outline case, is being worked on in that area for changes at the Royal Shrewsbury Hospital. There was a very big price tag. There is a very big price tag around this. So we know that our colleagues across the border there are working through the English systems permissions and authorizations of that. I think they've got a time frame of needing to submit that case before the end of this calendar year. So as always, with very significant capital investments of many multiples of millions, there will be a lot of scrutiny on that. So we can't expect it to be a very rapid process, but actually you've got to put the case in and on the table for government officials and departments and NHS England to start scrutinising it. So that's where we believe things are at the moment. In the meeting, I think it was just yesterday, again, the health board represented by myself and the director of planning and performance, who's also my deputy chief exec, and also colleagues from the Community Health Council there. So pretty, I would say robust presentation presence from Powys in that mechanism. Thank you, Adrian. That was a great question. Give me a chance to update on that.
Good, and very timely as well, if those are the key milestones that are coming ahead. And I think also Shrewsbury and Telford is an example that highlights that for Powys, given our rurality, many of our residents rely on acute hospitals in neighbouring counties for their acute care. And one of the issues that have come up in the questions tonight and that we hear about from our communities is their anxiety about ambulance response times. Clearly, ambulance responses they're not an issue on their own. They depend a lot on the capacity within hospitals, and which in turn relates to the capacity of the care sector for people to leave hospitals. But overall, what kind of steps are being taken to improve ambulance response in an area like ours?
Yeah, well, I feel I need to start with an apology, if I'm honest, in that I know of a number of cases where the situation's been really difficult. An individual member of the public, a member of our community, has required an ambulance, and that ambulance has been significantly delayed, and that's not what I want or anyone wants for the people of Powys, or for anyone really. So I apologise on behalf of the NHS for that real difficulty and the distress that I know that causes. I described earlier some of the reason behind the challenge, and that the hospital system literally getting log jammed, and the ambulance service therefore not able to move patients from the back of their ambulances into the hospital, and hence not being able to get back on the road. You may well have seen that there's been a similar situation in Scotland and in parts of England as well. So whilst our focus is Wales, of course, and Powys in particular, this has been happening across the UK. Scotland called on the support of the military, and that was seen to be helpful. And so the Welsh Government has called on the support of the military as well for the Welsh Ambulance Services Trust, and I understand that support is now being provided on the ground, so to speak. So the expansion of the ambulance service is really, really important to try to respond swiftly. But as I described this to colleagues a few weeks ago, it's like having a bath, the bath being the hospital healthcare system, and the plug is in it and the taps are on full. The bath will fill up and overflow, and that is really what the health and care system has been like. So people have got sort of stuck on it. So yes, we can put more ambulances on and more vehicles to respond, but actually, unless we get people moving through the system more effectively, we're just adding in, we're not dealing with the core issue. So to deal with the core issue are some of those things that I mentioned on the slide earlier about the preparing for winter. We need to make sure that we're able, and we start right at the sort of community end, if you like, I call it the back end, but making sure that we're able to discharge people from hospitals, or that they're able to stay at home in the first instance. So that means community services, that means domiciliary care, voluntary sector home care support, it means district nursing, it means being able to offer medical consultations and advice in the community setting, so either at home or over the phone. And that's a real focus for us. How do we ensure that people can get home from hospital or be prevented from going into hospital if they're really not going to benefit from that hospitalisation, and if we can provide a really more effective offer for them staying in their own home. So that's one part of that. We then need our hospital systems to be working effectively. The pressure of staffing is significant, but we're hoping as case rates start to come down, that staffing pressure will ease a little bit and we'll have more beds in our hospitals and we're able to move through. We're also looking at the bed spacing. What's the rules and regs that we need to put in place now? And we're a bit tentative about that, if I'm being truthful with you, because we've still got really high COVID rates in our communities. So we want to make sure that a safe environment in hospital settings, and that hospitals don't become the place where COVID actually spreads. So really taking that into account. And then I mentioned earlier about the same day emergency service. So if somebody needs some attention that day, how can we provide that? How can we provide it really swiftly? It may be that actually expanding MIU provision, or it may well be that offering a community response, falls service and those sorts of things. And all of those are on our list of areas that we think we could offer to people in our communities to try and help support that. But once we've got the flow moving through, we should be in a much better position, and our ambulance service should be able to respond to those calls much more swiftly. I don't want to sound overly optimistic. I want to sound realistic. I think we have some real challenges to come, but I can tell you that we are really focused on this, and our efforts are going into this with real gusto to do whatever we can to support people to get the right care as timely as possible through this autumn and winter, and that means ambulance services as well. Thanks, Adrian.
Thanks, Carol. And that's a really sort of salutary reminder, isn't it, about just how hard staff and volunteers are working across the health and care sector at the moment. So our sincere thanks to everybody who's giving their time, and thank you to all of the patients and communities for treating staff and volunteers with respect and dignity during these challenging times as well. Now, I'm conscious of the time, and we've mainly covered questions that didn't relate specifically to COVID, although COVID still is very much an issue that underpins all of those answers that you've just given. So I think if we've just got time for one more question, it might be a little bit of a crystal ball time, but at the moment, 16 to 17-year-olds are normally just offered a first dose, not a second dose, based on current UK guidance. What do you think is the likelihood that we'll be moving also to a second dose for 16 and 17-year-olds?
Oh, what a great question. What is really clear is that COVID finds its way to people who are unvaccinated or potentially under-vaccinated, and we know that one dose gives so much protection, and the second dose, helps to push it up. So I'm not a betting woman, but my sense would be that JCVI will very seriously look at the 16 and 17-year-olds. I have a 16-year-old in my household. They are very social people. Generally, they like to go out, catch up with friends. They're at school. They're doing all sorts of things, and so potentially they could be seen as super spreaders. I can imagine a scenario where the JCVI think, let's really protect them, because the vaccine does reduce transmission, doesn't eradicate it, of course, but it reduces transmission, and that has an overall community positive effect as well as the individual. So my sense would be, Adrian, on that one, that I would think we will wander down that area. I want to stress that I have no inside knowledge about this, but I do know they're looking at it, but I don't know what the deliberations are. So, but we'll stand ready, won't we? We've got the mass vaccine centres. We've got, as you've mentioned, fantastic volunteers. And if anyone wishes to volunteer, please do come forward. It's I hope a great experience to be part of something as important as this. But we'll be ready. By hook or by crook, we'll be ready for those 16 and 17-year-old second doses, and for those who are under 50 who may then become eligible for a booster dose as well. So we'll do our very best as a health board with partners to deliver this programme as best we can.
Thank you. And indeed, it's a sign of how fast the booster programme is going, that even in the time since we put those slides together, we're now over 11,500 booster doses delivered, and that includes around 6,000 of our most elderly residents as well, the over 80s. That's 6,000 of our over 80s have received their boosters already. So thanks to everybody who's made that possible. So I think this really is just an opportunity for any final closing comments that you'd like to make for us to finish tonight's proceedings.
Oh, lovely. Thank you very much. Well, the first thing to say is we'd love to hear your feedback. We've been doing these public briefings and Q&A sessions for all of this year now. I think we might have had a month off in the summer, but all of this year. Please do tell us if they're useful. Please do tell us the things that you would like us to cover. We've had a couple of sort of specific focus sessions. So one we talked about mental health, another we talked about our aspirations around Health and Care Academy. So, we can be responsive to the areas that members of the public are most interested in. We like to try and keep it sort of pan-Powys if we can. So please let us know. But as we find ourselves with the nights drawing in a little, our attention does turn to winter. We know it's likely to be a very challenging winter. I'd ask us all to prepare the best we can for the time ahead. But we will also know that after winter comes spring, and if we're able to look forward that far, I'm looking forward with optimism that we will have again delivered an excellent vaccine campaign, that we'll have winter and the winter viruses behind us, and that we'll have a spring and summer ahead where, again, it's going to be tough and we've got a lot of work to catch up on as a result of the pandemic, but we have a better run at some of those other things that we really need to do. So I want to thank everyone for their continued support of the Health Board. As Adrian said, it really does make a difference to health and care staff when members of our community can appreciate the challenges that they're under. We don't get it right all the time. I absolutely know that. But we are going to do our very best to support the people of Powys and do that with you as communities. So diolch yn fawr iawn. Thank you all very, very much indeed. And that means we'll draw this evening's briefing to a close, and we'll see you next time. And I think that's somewhere in November, so a step closer to the end of this year. So thank you very much indeed.